Welcome to another episode of Gigi's Talk. We have all seen that emotions are great and emotions are needed by all human beings. But when does a human fail in the emotional field? Probably when you are not looking that good, is it? In that case, we have a special guest who looks after skincare. She's an expert in it and she knows how to make you look good and emotionally well capable of. So let's welcome Poonam, who is a doctor and who is a dermatologist. Welcome, Poonam, to Gigi's Talk.
Thank you. Thank you for giving me this opportunity so that I can make you aware that what kind of skincare you should be doing.
Dr. Poonam, there are so many conceptions, too many knowledge, too many videos, too many audios available online today. Do this for your shiny skin. Do this for your hair. All kind of videos are available. But being a doctor, would you recommend anyone to go through the videos and follow them as it is?
Absolutely not. I will not recommend to follow each and everything. At least don't try out anything on your skin because your skin is a body part of yours. You will not follow something which is very blind, which you have not tasted before, or just someone is telling, will you do that? So it's for your body. So I don't think it is good, and we should not go for any such type of skincare rather other than a dermatologist who is really knowing what is exactly your skin type, what is exactly needed at this condition for your skin. So it's absolutely not recommended.
So when we say about skincare, most of the youngsters out there and the females who are our clients face certain issues which is prominent and mostly there in all of them. Probably acne, pimples, or rashes. They try all the product in the market and then come out with rashes and something else. So, how would you recommend that if they want to try a new product or something, how do they go about it?
So, if you want to try some new product on your skin, it's always better to go for the patch testing. You have to take some amount of cream or any formula that you are going to use on your back of the ear. Wait for 48 hours. And if it is not causing you any problem, then only you should try it. Even after patch testing, it's not like that you will not face any problem like allergic reactions. Some kind of allergic reactions they happen in a delayed way also. They can present you later also. But at least whatever the dangerous type of allergies are, like immediately if you apply something and the skin gets burned. So that's why any product if you want to go for, you should do patch testing.
How about the products that are used in the eyes or on the lips?
Yeah, for the eyes and lips, I actually don't prefer anything should be there close to eyes unless and until there is a caution also on the product information also. Go through the content. If it is safe for the skin around eyes, then only use it. And for the lips, immediately if after applying you feel any kind of burning, wash it. Don't use it later on.
In case somebody has applied something and has got some reaction to it, what is the first step that they need to take?
The first step is that first you have to find out what the exactly product that caused allergy means that caused you the reaction. And if you are not getting that, because we must many times we use too many products and then we are not able to find out which product we have used. So whatever the product you are using, stop it immediately. If you notice any kind of rashes, stop the product immediately. Don't use any kind of soap, any kind of face wash on that area, affected area. Try to moisturize it as much as possible. And even after these measures, if the allergy is not subsiding, then it's better to get consulted with a dermatologist so that we can find out what is the exact stage of the rash is there, Is it a type? Is it a type of eczema? Is it a type of just a dermatitis, which we can treat it with the medicated creams?
Now, coming to that, you took two names, eczema and dermatitis. So, could you explain?
Actually, eczema is already in three stages. That is acute eczema, subacute eczema, and chronic eczema. Acute eczema, that means your skin has just started the swelling.
Mhm.
So that's why the immediate reaction is like something is coming, some and it is disturbing, and we just go on little bit scratching, even though unknowingly we just you means go on scratching. So and sometimes the small bubbles also they come, and that is the actually acute stage of eczema. Once we become, sometimes we ignore it, we just try to use treat it with the moisturizers, then this eczema only goes to the subacute stage. Means there the inflammation in the skin's layer that remains, and the swelling in the cells that also continuously there, but we don't feel that kind of itching in that stage. And slowly what happens, the body's defense mechanism that gets activated, the skin starts to become little thicker in appearance. And then comes the later stage, that is the chronic eczema, where the skin completely becomes thick. You don't feel any kind of itching, but if sometimes you scratch it or you try to manage it with some other medications and all, there is a possibility of secondary infections, or there is again a possibility of cuts, and through that cuts again there are the chances of getting secondarily infected. Considering dermatitis is only some kind of inflammation only. So acute eczema and dermatitis are they don't have distinct margin, actually different, we cannot completely differentiate in between these two.
For the youngsters, their emotional quotient and their emotional well-being is very much related to their looks. They are happy if they look good and somebody says, oh, you look pretty and beautiful. Otherwise, you know how they feel. So when I'm speaking about the youngsters and the women out there, everybody wants to look good. That is definitely there. But what about when it comes to pimples and things in the growing up stages and during the hormonal changes as well? So these pimples leave a mark. Even freckles are a reason for people's concern. So could you address that?
Yeah, in the youngsters, getting pimple is not a uncommon thing. It's very common. All the people on and off in some stage of life can get it. So as such, there is nothing to worry. Even one or two pimples are there. We sometimes there is no nothing to bother about it. But if you start just popping it, then definitely it will leave the mark. So, popping a pimple is not a solution for that. There are certain anti-pimple creams which over the counter you can use, and you can make these one or two pimples under control. Even nowadays, the pimple patches are there, so to avoid that popping of the pimple, which will not cause the marks of of those pimples. So it's always better to use such things. And in youngsters, actually, what they avoid is they avoid the hygiene. Means if I come across many patients, like they're telling that they're washing hardly one times in a day their face, even though I tell them that at least two times a day they need to wash. But most of they are hesitant. Why should we wash two times? Or sometimes they wash excessively, and that excessive washing also damages the skin. So at least according to your skin, two times washing and cleaning your face is more important. And even though if you're getting some breakout, then over the counter preparations also work. Other things like diet and practicing healthy lifestyle, that also of great importance. But they neglect again. If flare up happens, then there are treatment. Even if someone is having more marks, then we have all the range of treatment to treat it. The thing is that prevention is always better. So everyone, I think, should be careful about these things.
So, what should be the ideal way of washing a face for oily, normal, and dry skin?
Yeah, even though having means actually we as a dermatologist, when some we examine the patient, if they're feeling that means their skin is oily, then there are certain kind of face washes those are recommended. With those face washes, little skin exfoliation happens, and that clean their skin because oily skin means whatever the dead skin is there, whatever the pores are there, they tend to block. So we just have to avoid this blocking of the pores. Even though it is a oily, even though it is medium normal skin, it is a dry skin. For dry skin, we prefer mild kind of face washes. And for normal skin, again, there are non-foamy kind, even foamy also there, but they are not having some medicines in that. That is not having any kind of exfoliating agents in that. So
Okay.
these, even with face wash modification, we can use clean the skin properly.
So, doctor, one issue that I had also seen, and one of my client was also saying was she tried a new cream, and all of a sudden, bubble-like formations happened on the skin. Is it a normal
Mm.
thing, or does it happen to many products out there in the market? And how do you face it?
Skin, what is your skin's at present condition, that depends on that also. Many time we use some normal routine products also, but we face the allergic reaction or bubble kind. Bubble means she must be facing some kind of allergy. So allergy is again means too many products if you use some formulations, if they are of different means some interaction is happening in between them, then also you can have that allergic reaction. So it's always better to go with the simple and effective products according to your skin condition.
Would you recommend that once you visit a dermatologist, check out what your skin type is and then follow a certain procedure for your skin?
I am totally against of experimenting. If you want to experiment, then you have to go for the thorough contents of that product. What
Mhm.
is the content? What how it is going to affect on your skin? This thing you should be knowing. If you don't have that details about that product, then I will not recommend to experiment on your face. And actually, the patients they are coming even from the minor stages they are coming. Even one or two pimples they are bothering because they don't want they have seen that someone close from their family they have suffered a lot because of this pimple. So they don't want to go to that stage. So what they do, they just come, they get examined properly. If any procedure is needed, that we decide according to the skin, and then if they we can prevent that stage of their progress, then definitely that is a way better actually for them.
What about all
Yeah.
the organic products now in the market? In the name of Ayurveda, also, original Ayurvedic products are definitely there, but a lot more of said organic products are there in the market today. How do you check it? Or how can we be safe from it?
Actually, whatever many branded products they are claiming that they are completely natural, they are derived from Ayurvedic content and all. But what I have seen their content, most of them are not that natural. They are actually the same ingredient that we are using in many of the medicine. Or sometimes, even though they don't mention what are the other things, like the salicylic acid, they don't mention that they have salicylic acid many times, but they have some amount of salicylic acid in them. And every each for each and every one salicylic acid is not needed. That's why all the organic product, even if they are telling that they are organic, there is no as such authenticity. You just know whatever the Skin means sometimes now we are referring means organic product because someone is recommending. And nowadays, this advertising campaigning and all that that is happening at a bigger scale. So many influencers they are promoting that this is completely natural and I have used this and you also please go for such product. But absolutely means unless and until you feel the difference, it is not working for you. Pure, natural, authentic products are there. They have only two or three ingredients and they are actually very less irritating when you apply on the skin. You don't feel anything. Whatever the product that you are using continuously, and you have that firm belief that this is working for me and I will keep this continue because I'm not facing any skin issues with that, then definitely you can go for those products.
So what you recommend as a doctor is do your patch test. If it works out, then okay. If you
Yeah.
are taking into consideration somebody else's recommendation, then that might have worked for them, but not for you. So be careful, do your patch test, and then only
Yeah.
go for any product. In this situation, right after COVID, there is a rise in one disease, particularly amongst all the people in the world. And one of them is skin cancer. Is
Yeah.
there a check we can check whether we are into it or not, or is there any way of checking ourselves or by a dermatologist to see if a patch on our skin could be leading to that?
Actually, for yourself, you can check. Like if you are noticing any mole on your skin, which is recently coming, which appearance has changed, which size has changed, and if it is having a color change in it, then definitely you can get it checked. There are certain apps also with which we can primarily get it checked. Those are available at the means telemedicine platform also.
Mhm.
And from the dermatology, if we want to get it checked, then we have a special instruments for them, like dermatoscopy and all that. With that, first we visually check it, and if needed, we go for the biopsy because most of the time some lesions are like that. Even though with dermatoscopy, we don't find any cancerous changes in them. When we go for the biopsy, then we can see the evidence of skin cancer.
So it can actually be anywhere on the skin. There are other skin
Yeah,
conditions like the urticaria or psoriasis, I think.
yeah.
What is actually that and how do you go about it?
Urticaria, psoriasis, vitiligo, mostly these comes under autoimmune conditions.
Okay.
Autoimmune conditions means there is no one definite reason for that. There could be some underlying conditions which cause this, even SLE, the skin, many patients they have that lupus
Mhm.
erythematosus. So that is again autoimmune condition
Mhm.
where your other systems are involved, and because this system also the skin is also getting involved in that, and
Okay.
that's why you see the lesions on the skin.
So basically, any lesion on your skin that is persistent, you need to check it out with a dermatologist
Yeah,
and go for the regular
yeah.
procedure of checkup. What about fungal infections on the skin?
Fungal infection nowadays these are very common,
Mhm.
and as the fungus is also evolving nowadays, there is a big question how effective is our immunity. Not only fungal infections, skin viral infections are also common, viral what, and these are highly contagious things from
Mhm.
one person to another. There is a high chances of transmission. So that's why even in the family, someone gets it again. If he is not recovered completely, the recovered person can get it.
So you mean to say skin conditions can be contagious as well. You need to be very careful
Yeah,
that you're not transmitting it to other person in the family and around you. So
yeah. That you should know which is the contagious thing and which is not infectious thing.
So this happens only when you visit a doctor like you and then come to know whether it is infectious or not, right? What, as an expert, would be your basic advice to anyone out there? how to look after their skin and how to go about it.
Yeah, skin care, everyone wants to be perfect actually. And the thing is that whatever the product you are using, if you are confident they are not causing me any harm, then definitely go for that only. Don't change any product unless and until you are very sure about it, or you are not facing any problem, then only go for such kind of product and get your skin examinations whenever you notice some changes, because skin conditions are like itching, irritation that disturbs a lot, that completely disturb our routine also, and mental conditions also, they are related to skin problems. So that's why whenever you see some changes in your skin, if you approach it early with the right advice, then definitely it can be managed in easy way. We don't have to go for a long period.
Okay.
Then most of the time patients come to us when they have their recurrent conditions, or they just try to manage it.
Okay.
Just yesterday the patient was there, he took medicines from the dermatologist, which he was prescribed 3 months back, the same medicines he did,
Okay.
and the thing happened like that. Rather than getting benefit, it was not helpful for him, because the condition at that time must be different, the condition at this time is different.
So, as a doctor, what you recommend is even the regular product can give you allergy, but once that allergy develops, you need to consult a dermatologist. And if you have been comfortable with a product, it is advisable not to keep changing the product very often. You stick to one product and follow it thoroughly till the end. Second thing, what you are saying is any wart or mole that happens on your skin needs a medical examination. Don't delay it. Just go ahead and take a test with a dermatologist. From the scalp to the toe, any discoloration or a disfigurement in your skin is qualifying for a dermatological examination. When we say skin care,
Yeah.
doesn't emotional health and physical health affect your skin?
Definitely, because if you are mentally fit and fine, emotionally you are fit and fine, you will be able to take care of your skin properly. And again, that will reflect the physical health, that will also reflect on your skin. Whatever the problems are there, they are just, we can minimize them, we can manage them well with the lifestyle modifications. So that's why lifestyle modification and maintaining your physical health, mental health, to give the complete overall skin health, that is important.
Okay, coming to skin, when we say skin, even our scalp is skin. So, hair loss, is it related to skin?
Hair loss is always, it is related to skin, because hair, nail, and skin, these are the integumentary part, that is the integument system from which all these parts develop. And that's why hair also comes in the part of skin only.
So,
It's
how do you
also
deal with
the
that
skin.
scalp problem? Dandruff is one, balding is one, then there are many issues with the hair. So, how do you deal with them then?
Most commonly, the dandruff problem is here and there, in younger generation, especially. As it is a kind of fungal infection, there are many types of dandruff. Not only dandruff is not a single condition, there are types also.
Okay.
So, according to the type of dandruff, we have to manage that skin, means that condition. Many times, if dandruff remains for longer duration, it is the cause for hair loss also. So, the person who is suffering from dandruff may lodge into the hair loss or balding also after some years or after some months, many
This
months.
was great news because I never knew that dandruff had many types. I knew dandruff as it is, one word dandruff. Coming to that, there are brittle nails, pus formation around the nails happening in. Is that also some symptom or condition?
Yeah. Pus formation around the nail, that is also common condition. And diabetes is one of the reason, those who are having uncontrolled sugar, they have the tendency of getting this commonly, and some people have like nail biting. These people also suffer from this condition very often. And younger generation, if they are wearing not correct type of footwear, then also that causes the problem repeatedly among them.
So one is skincare, that is your facial things, and the soap and other things that is involved, the shampoo. Even the footwear and the kind of things that you wear on your legs can cause skin irritation and can be the reason for skin diseases, right? The next important question that comes to my mind is many people have tags on their face, necks, hands, back, even on other places of the skin. Is there a process medically to remove them? Do you have creams or things, or is there a surgical procedure to remove the tags? And is it necessary to remove them?
Yeah, skin tag is a actually type of benign skin tumor only. Means there are again minor skin tags. If they are not growing too fast, then we can even manage them with certain creams.
Hmm.
But again, those creams you should use regularly, then only you will see the results. Many times, if you use it for some duration and you are expecting the change, then it won't happen. Most of the time, what people do, they scratch it or they want to remove it like just by twisting. Then this is going to harm your skin. For that purpose only, we advise them to get it removed surgically so that the complete thing will be removed, and that will be better healing in the early stages also. That's why we advise to remove them surgically. Creams option is there, but that is again a time taking thing.
Okay. But as you said, surgical removal of tags, does it need hospitalization or it is done within hours?
As it is a cosmetic procedure and OPD based procedure, so we don't need hospitalization for that unless and until if you have some underlying conditions like if you have some bleeding disorders, if you are on some medications, or if you have uncontrolled diabetes, then only.
You need
Otherwise, for normal people, it's not needed.
So you mean to say that tags can be removed within hours, no hospitalization, nothing. It's just an OPD procedure that is done. There are many kind of cancer that is surfacing in a much faster rate after COVID. Skin cancer is one of them. So how do you detect if you have it, and what is the procedure to go forward if you think you are facing one?
For skin cancer detection, we need a proper dermatological examination. As we are seeing many types of mole, we are able to differentiate if it is a normal mole, if it is a skin cancer. So that is a clinical examination one, and the other is like procedural, like dermatoscopy, with which it is like a magnification, which it is like a microscope that we are holding. With the help of that, some cancers can be identified, or they are identified at early stage. And later, the third is the biopsy. Skin biopsy, if we have to take a small piece, mostly we prefer this when there is a excessive growth. Then we don't have to wait. We have to take a small piece. We have to send it for the histopathological examination. And if it is a cancer, then whatever the big area is there, then we have to completely take it out. There are surgeries they are needed. Most of the time, if the lesion is too big, then we have to take a skin flap from them. And that procedure that never leaves a mark for them, even though we remove the bigger area.
Okay.
Otherwise, though, if it is a smaller thing, then it is managed well with a minor surgery,
Okay.
like only some scar that remains.
Okay. So what you say is if it is skin cancer, it normally starts with a mole. So you have to be
Yeah.
watchful of a new mole on your body if there is discoloration or if there is any changes or sudden growth happening on your body, on the skin. Is that all? Does it happen
Yeah.
around the skin on your feet, foot, or your nails? Is there any condition?
It can around foot means skin cancer is mostly on the skin only. So wherever the skin is there, there is a possibility of means
Okay.
cancer. Even on the nail, the melanoma can grow
Okay.
inside the nail bed. There are certain nail bed tumors are also there.
Mm-hmm.
Means they can also be cancerous.
Mm-hmm.
So anywhere on the skin, the even on the hair root, from the arising from the hair root, the cancer can happen. But
Okay.
basically, the appearance is like that. If it is arising, means if it is like a mole, sometime discoloration, sometime even not discoloration, but it is growing very fast.
There are sunscreens and other products available for UV protection and things. Would you recommend them, or would you like them people to check with a dermatologist first and then go ahead?
Yeah, sunscreen is a normal regular part nowadays as our in our skincare routine. We can prevent many things with this sunscreen. We usually, being a dermatologist, used to advise those only who are having some skin issues, like some skin conditions. They flare up with the skin, means with the UV rays. So we advise to use sunscreen regularly. But for the young persons, those who are having acne, and those who are getting exposed to UV rays daily because they're stepping out, and because of because of this their skin is getting tanned, because Indian skin is having means more chances of getting easily tanned. Our skin is like that only. So that's why the usage of regular sunscreen is really, really important to prevent these conditions later on. Because once the skin is getting tanned, then it is difficult for us to recover completely. And there are many patients who take other means medicines also, and because of that, their skin is reacting easily for the UV rays. Means those are photosensitizing medicines
Mhm.
that also again cause them problem. So
Okay.
that's why the sunscreen usage is recommended.
Okay. So apart from being hydrated and having a proper diet, sunscreen now has become a must if you are stepping out on a daily basis, because tanning can cause many other diseases, and one of the reason could be the medicine that you are having will be more photogenic to and reactive to UV rays. One last advice from your end as an expert that you would want to give our audience.
Take care of your complete overall health so that your skin will glow. And if you notice any problem in the skin, don't wait for too long. Just get it examined, get it treated as early as possible. Don't wait too long.
So, thank you, Dr. Poonam, for coming for this episode together. And I hope the message that you gave and the information and knowledge that you shared here would be valuable for many out there. Anyone
Yeah.
who wants to contact her or wants to reach out to her, have a problem, and you need think she can provide you a solution to that, please reach out to the details given in the description box.